Now, several days ago, I published an article for the American Institute for Economic Research titled The Anatomy of Government Failure in a Pandemic. And this is in contrast to the problem of market failure. Now, market failure is a pretty obvious problem during a pandemic. There are lots and lots and lots of uncompensated spillover costs and benefits to people's actions, suggesting that maybe the government should step in. However, just because the government might want to step in doesn't mean that the government should step in. Moreover, it means that we need to be especially mindful of the problems faced by government regulators during a time such as this. Specifically, the problems faced by governments with respect to the information at their disposal and with respect to the incentives that they face. So consider information. Well, first, governments don't know everything, and that's pretty obvious. Governments may not know people's underlying risk preference or people's underlying risk tolerance, their underlying willingness to take a risk in order to avoid something like the coronavirus. Importantly, governments have very strong incentives to avoid being blamed for things. And here, when we think about regulators, we can think about two different mistakes that regulators might make. First, they might approve a bad drug or a bad treatment. And in this case, it's pretty obvious that they failed. Second, they might fail to approve a good drug or a good treatment. And it might seem pretty obvious to people like economists that they failed, but you may not necessarily have the same kind of news coverage or whatnot that you would get when they approve a bad drug or a bad treatment, even though failure to approve a good drug or failure to approve a good treatment could be just as disastrous as approving a bad drug or a bad treatment. Let's consider some examples. Battelle, based in Columbus, Ohio, came up with a way to sterilize masks because we're running out of them. Lots of hospitals and lots of healthcare providers need masks in very large quantities, and we're having trouble ramping up production as quickly as we would like. Battelle came up with a method that would allow them to sterilize the masks that a lot of hospitals and healthcare providers are using, but the FDA stepped in and said, well, you can only do 10,000 a day. Now, Battelle says that each of the machines that they have for this has a capacity of 80,000 masks a day. So the FDA is stepping in and standing in the way of market innovation that would help to go toward addressing the problem of the coronavirus pandemic. Similarly, several firms have come up with at-home coronavirus tests. And one of the problems we have in the US, particularly relative to a lot of other countries, is the relatively slow pace with which we've been testing people. The development of at-home coronavirus testing kits seems like a pretty obvious solution. However, a lot of the companies that were making these tests stopped making them or said we're not going to ship them after the FDA stepped in and said, well, we haven't approved these yet. Now, it's true that there might be some problems with at-home testing. Specifically, false positives might send more people to the hospital than would be advisable. Second, false negatives might mean that a lot of people think they're healthy when in fact actually they're either sick or they're at risk for transmitting the coronavirus to other people. But this strikes me as a relatively small problem compared to the problem of serious undertesting in the United States. In the case of mask sterilization and in the case of at-home coronavirus testing kits, we have an example of the government standing in the way of innovation and specifically standing between people and the resources that they need in order to solve a very serious social problem. In a lot of ways, they make the perfect the enemy of the good. It's true that some at-home coronavirus test kits may not work, and maybe we will get false positives and false negatives. However, the much larger problem almost certainly is the fact that we're not testing nearly enough people. Furthermore, in the case of the masks, the much larger problem than masks being perfect or masks being imperfect is simply not having enough of them. And if Battelle can sterilize enough masks to slow down the progress of the coronavirus, then that ultimately is an unambiguous win. Consider too some other problems. Now then, social distancing is a very important and very effective way to flatten the curve, so to speak, and slow the spread of the coronavirus. Now then, a lot of people have been staying at home and a lot of people have been having things delivered, and that's great. However, A lot of the things that are being delivered by hand, by FedEx, by UPS, by Amazon, or by the US Postal Service. And while it's cool when our mailman comes by every day, he's handling our mail, and then we're handling our mail, but he's handling mail for everybody in the neighborhood, and then they're handling that mail. Now then, there should be, or at least it seems like there should be, some more efficient and cleaner ways to do this. And we could do this if we had unmanned drone delivery of packages and unmanned drone delivery of mail. However, this has been held up by the Federal Aviation Administration. Several years ago, Amazon rolled out prototypes of what they envisioned for drone delivery of packages and parcels. And the FAA said, well, you kind of can't really do that, or we don't have anywhere in the regulation that allows you to do that. Now, here, several years later, we don't have unmanned drone delivery. We do have hand to hand delivery, and the risk, again, of hand to hand contact and hand to hand transmission of the coronavirus. By standing in the way of innovation in unmanned drone delivery, the FAA has unwittingly encouraged the propagation of the coronavirus and encouraged the spread of diseases and encouraged the kinds of behaviors and the kinds of practices that are not, in fact, going to flatten the curve and that are going to make this a much worse problem than it would probably otherwise be. So if we were to allow more innovation in medical supplies and more innovation in drone delivery, we would slow the spread of the coronavirus and make this a much more manageable problem than it would otherwise be. Consider, too, the incentives facing the Transportation Security Administration. Historically, or at least for the last several years, you've been limited in the size of the bottles and packages and things like that you could carry on with you. This means that people have been limited in the amount of hand sanitizer they could carry on. Now, fortunately, the TSA has recently eased up on some of these restrictions and is allowing people to carry on larger bottles of hand sanitizer than they could previously. But when we look back and think about the restrictions on hand sanitizer transportation over the last several years, we have to wonder how many people have gotten sick because they weren't able to carry enough hand sanitizer on a plane, or because they said, we're going to forget about the hand sanitizer when packing their luggage. This, again, has been an example of a government agency standing in the way of individual action that helps to solve a particular problem, which in this case is the transmission of communicable diseases. What's really important to keep in mind is that there are a lot of things in the world that are contagious, diseases among them, but also we have to consider trade-offs like the fact that ideas are also contagious. The economist Edward Glaser has done a lot of really interesting research on the economics of cities, and in 2018, the economist Paul Romer won the Nobel Prize in part for some of his work on how ideas tend to percolate in large cities. So a few things that we want to keep in mind as we address the coronavirus pandemic are like the things that I've talked about earlier with respect to innovation and with respect to allowing the price mechanism to work. We also want to make sure that we're trying to strike a proper balance between positive spillovers and negative spillovers. In the case of something like the coronavirus pandemic, it probably seems like we should err on the side of caution. However, going forward, we want to make sure that we're not throttling the contagious transmission of ideas in order to slow down the contagious transmission of disease. Okay? Now then, slowing down disease obviously is a very, very good thing. But the question, again, that we ultimately want to ask is whether the institutions we're putting in place in order to combat disease transmission might not, in the long run, lead to a slower transmission of new, interesting, and innovative ideas. The economic historian Robert Higgs has done a lot of really interesting research on the growth of government during times of crisis. Now, there are arguments to be made for government intervention when there are externalities, when we're talking about the provision of basic public goods or things like that. However, there are a lot of other things governments do for which the argument is a lot less clear. Nonetheless, as Higgs points out, government power has tended to grow after crises, specifically World War I, World War II, and the Great Depression. We could probably expect government power and government authority to grow in response to the coronavirus pandemic, and specifically to grow in ways and to grow in places where the argument for government intervention is a lot less clear than it is in the case of, say, something like slowing disease transmission. Ultimately, innovation is what helps us overcome crises. Ideas help us overcome crises. And innovation, in order to be effective and in order to do its full work, I think should be permissionless. The government fails when it expects people to ask for permission to innovate, to try new things, to develop new treatments, to develop new processes, to develop new technologies. I think that if we were to pursue a future of permissionless innovation, I think we would find ourselves much better equipped to deal with not just the problems that we're facing right now, but the next problem that's around the corner or the next pandemic.